CBS 6 News starts now.
5 years ago, a global health pandemic stopped the world on its axis. Tonight, a look back at COVID-19 and the lessons learned.
It could happen again very easily,
Are we prepared for when it does? Good evening. By March 2020, the COVID-19 virus had been circulating for months, but it became a pandemic overnight. The first case in New York State was reported March 1st. March 11th, the World Health Organization declared COVID-19 a global pandemic. And that same day, Dr. Anthony Fauci, then chief medical advisor to President Trump, addressed Congress.
And things will get worse than they are right now. Bottom line, it's going to get worse.
President Donald Trump declared a nationwide emergency and issued a travel ban that day, and the NBA suspended its season after learning of a positive case. The next day, March 12th, the first cases are reported here in the Capital Region. March 16th, New York City and Capital Region schools begin canceling classes, kicking off a trend that went statewide 2 days later. New York State's stay-at-home order took effect March 22nd. And March 25th, the date of then-Governor Andrew Cuomo's infamous directive to return COVID-positive patients to nursing homes. The pandemic was transformative for Andrew Cuomo's career for both the good and the bad. It thrust him into the national spotlight with daily COVID briefings.
And we kick coronavirus ass. That's what I say. Stay at home. I know the isolation can be boring and oppressive. It is better than the alternative. Remember, this is about protecting vulnerable people. It's a mistake. It's insensitive. It's arrogant. It's self-destructive. It's disrespectful to other people. And it has to stop, and it has to stop now. You pick the 26,000 people who are going to die because you only sent 400 ventilators. I don't care, frankly. This is a public health issue, and you cannot endanger other people's health.
Andrew Cuomo's pandemic leadership sparked speculation of a presidential bid. He wrote a memoir about that leadership and continues to lean on his legacy to this day.
If you knew you were going to face a pandemic, which no governor in the country really knew, but if you knew you were going to face a pandemic, I would have done much more preparatory work in the years preceding.
The hindsight is 2020. In 2020, no one was quite sure what to do, how to handle this killer disease. On March 25th of that year, Governor Cuomo sent elderly patients with COVID into nursing homes. He said he was following federal guidance. What happened next? Well, 15,000 elderly New Yorkers perished in those nursing homes. It may be the best remembered date here in New York from the pandemic, March 25th, 2020. It was a March 25th order from the administration of then-Governor Andrew Cuomo that forced nursing homes to accept COVID-positive patients. Within weeks, even days, COVID raced through nursing homes, killing thousands of elderly New Yorkers.
COVID pushed us to our limits. It pushed me to my limits. Nobody had an idea where we were. It was a matter of life and death.
Ground zero in the Capital Region may have been the Diamond Hill nursing home in Troy. More than a dozen patients died there in the weeks following that March 25th order. Across town at the Rensselaer County nursing home, the county executive, Steve McLaughlin, defied the order.
It's probably, if I look back on my career years from now, it might be the most consequential thing that I've ever done.
COVID patients were not admitted there, and McLaughlin says just one previously healthy patient died, along with 4 who were in hospice.
It was an evil order. It was despicable. I think anybody reading it would say, what are you doing? You're going to kill these people. And he did.
Just over a month later, the March 25th order was rescinded. The state ordered a probe into what happened in nursing homes, and a Department of Health report came out saying it was not the March 25th order and sick patients, but employees who brought COVID into nursing homes. There were immediate claims that people in Cuomo's office changed the wording in that report, rewrote parts of it.
In fact, it was just a document to cover up their mistakes, which is the worst kind of fraud.
Assemblymember Ron Kim, a Democrat just like Andrew Cuomo, blames Cuomo for the deaths of thousands of nursing home patients, including his uncle. Cuomo and Kim were very publicly at odds over the state's handling of the pandemic, making Kim one of the first Democrats to take a stance against Cuomo. He would not be the last.
No one knew what they were doing. I think the public understood people were making mistakes. But why double down? Why triple down? Why try to hide the data around the life and death toll numbers in nursing homes and leave people out of the process?
More than 15,000 New Yorkers died in nursing homes, a number the Cuomo administration admittedly tried to keep under wraps. They said out of fear of the treatment they'd get from the federal government. When Cuomo was held accountable on the nursing home numbers, he said this.
But who cares? 33, 28, died in a hospital, died in a nursing home. They died.
And as he runs for mayor of New York City now, Cuomo is still being asked about it repeatedly.
We had it worst, and we were alone, literally on the globe. No one coming to our assistance. It was just us. Just us.
And as for those numbers, during the pandemic, virtually every state in the nation encountered a nursing home patient who was transferred to a hospital and died there as a nursing home death. New York State did not, at least not for a very long time. Well, 5 years later, the effects of the pandemic on kids in our schools can still be felt, that's for sure. With cases quickly rising in the hectic early days, remote learning became the norm, an attempt to replicate the classroom setting in the safety of students' homes. But grades suffered. That's even if students still showed up to virtual classes. Here is JT Fetch.
There are some new gaps that the school districts are having to figure out how to fill in, but they're not going to do that with testing. The trick is figuring out how to bring students back to school. Some of them are dropping out, leaving entirely.
A DePaul University study found rates of violence and aggression against teachers dipped during the pandemic, but incidents in many cases got even worse once remote learning ended. Verbal or threatening aggression aimed at teachers, and not just from students. Parents and even colleagues and administrators have been more aggressive too, creating stress and anxiety, leading teachers to consider another line of work.
When it becomes difficult to go to work and when you feel unsafe and when you might have experienced sort of a threat or an attack, of course, that doesn't lead to wanting to stay there, right? That it would be a very normal reaction to want to leave.
Perhaps the largest impact still felt, learning loss. For the past 5 years, standardized test scores have tanked and students are behind by one or more grade levels in key subjects like reading, math, and science.
If we compare the students that we have coming in now to a few years ago, generally we're seeing lower levels of knowledge and understanding. I think there's going to be really long-term effects as a result of this pandemic.
Now a bold new push from Governor Hochul to ban phone use during the school day, an attempt to reverse that learning loss and improve the mental health of students, many of them so used to growing up with screens and isolation. If put into the state budget, the ban will take effect in the fall.
When COVID hit the capital region in the second week of March, a command center at Albany Med revved up into high gear for the challenges ahead. 5 years later, those dedicated medical professionals share their memories exclusively with Liz Bishop.
One of the most vivid memories I have is seeing all the doctors, all the nurses, all the respiratory therapists lined up, ready to care for all the people that were coming in with COVID.
Because COVID was such a powerful enemy, Albany Med's 10,000 employees found themselves girding up for battle on an exhausting number of fronts.
In the beginning, it was how do you test for COVID?
Dr. Dennis McKenna was then a month away from taking over the reins from retiring CEO Jim Barba.
And then it was how do you treat COVID? It's also how do you deliver babies in a COVID environment? How do you do surgeries? How do you take care of heart attacks? What to do with our workforce.
The day-to-day challenges arrived with such fury, the staff had little time to dwell on the personal risks.
I think we lived in real time. We had the right PPE. We had staff staying home when they were ill. We all knew what to do from our preparations. I look at it as here was the safest place to be.
It would be a full 9 months before a nurse in New York became the first American outside of a clinical trial to receive a COVID-19 vaccine.
When the vaccine came out, it felt like the sun came out again. For the first time in a very long time.
I remember we set up a very large clinic down in at the ground level of one of our buildings, and there were hundreds of people lined up, staff lined up to get it. People crying, when they got it.
There were certainly moments where we felt overwhelmed, exhausted, tired, but I knew that we had the best team, and I think we proved that to be true.
A team that was stronger for the experience.
People we didn't know before that we, have deep bonds with now for going through this.
Liz Bishop, CBS 6 News, Albany.
And please stay with us tonight. The pandemic put the service industry in a standstill. It hasn't been the same since. And when workers across industries were left without jobs, CBS 6 got them results at the Department of Labor. Plus, the important behind-the-scenes work in the pandemic that is still going strong to this day. The COVID-19 pandemic turned the service industry upside down, forcing restaurants to make drastic changes to survive, from a viral food trend to permanent policy shifts. CBS 6's Brandon Sapardi takes a look at where restaurants stand today.
Some of them were downright ridiculous. So first we had to close, then we could open, but only for takeout. Then we could suddenly do takeout, but we could only sell alcohol to go if you bought food with it. Then we could open, but you had to have so much distance between tables.
Many restaurants barely made it through, while others found creative workarounds to survive.
We see the tweet that comes out that says food has to be served, for alcohol service. So I was just like, well, let's just do chips for $1. And then Adam's like, call them Cuomo chips. And I was like, oh, that's a good idea.
Crunchy, salty, delicious, and at one point essential for ordering a drink in New York. Cuomo chips started as a lighthearted way to comply with state regulations during the height of the pandemic, but it quickly became a viral sensation of its own.
CBS 6 was the first to share the story about Cuomo chips before it made headlines not just across the country, but around the world.
We had people from like Australia,
Texas,
England, all over the place,
that were ordering chips for our guests here and paying for that.
In your wildest dreams, did you imagine it going viral?
No, not at all. I thought it'd be a funny thing around here with like our bar regulars.
Another pandemic-era measure had a more lasting impact.
One of the most positive things coming out of the pandemic was to-go alcohol sales. It allowed us to make extra money and keep our doors open. A lot of restaurants are still doing to-go alcohol sales today.
While some changes stuck, challenges remain.
The overall culture of restaurants and hospitality kind of shifted a little bit.
We had a massive amount of people left the industry and became harder to find people to work. And a lot of the products we use today now cost as much as 300% more than they did right before the pandemic.
Now, within weeks of the stay-at-home order, CBS 6 learned of thousands of unemployed New Yorkers who were still waiting and waiting on unemployment benefits. It was our reporting on this broken system that got results for so many. We are joined now by my former co-anchor, Ann McCloy, who really was a hero to so many people in the Albany area during COVID, especially the initial stages, because you helped get them their unemployment insurance, their lifeline. And it all started with a man who walked into our parking lot. So take it from there.
Right. One of our weathermen was in the parking lot, Craig Adams, and this man walked up to him crying and said, I don't have any money and all of the businesses are shut down. I can't go to work. I don't know what I'm going to do. So actually, he took down the phone number, and I ended up interviewing this man and helped him get his unemployment. And I was interviewing Governor Cuomo at the time. I was going to those daily COVID briefings. And so we had the opportunity to ask the governor questions. I went on a Sunday. It was 7 days a week at that time.
You were on vacation, I think, at the time.
I was at Lake George with my husband trying to get a break from all of the COVID reporting. And I learned that Cuomo was going to be in Albany. And so I got in the car and rushed down to the Capitol. And I just started asking Governor Cuomo questions about the unemployment. And it really seemed like there was a disconnect between the government and what was really happening. Basically, there were thousands of people that were put out of work from the government shutdown that couldn't get through to the Department of Labor.
But you became the connection. You opened their eyes to it, and they started taking names from you, and it just snowballed, right?
Right. When I told the governor about this man that showed up crying in the parking lot, you could see in his face that, we need to respond to this. And so after the story aired, I started getting hundreds of messages on social media from people in Albany, in New York City, that couldn't get their unemployment benefits. And Cuomo's secretary to the governor, Melissa DeRosa, actually messaged me on Twitter and said, I'm going to help you get help to these people. She said, give me the name of anyone who contacts you and we'll try to get them their unemployment. So I started making a list, and one night after the first story aired, we had hundreds of people. So I had a list of hundreds. And I gathered all their information and I emailed them to her, and she said, keep them coming. And so every time, we started doing stories every night. Right. And eventually thousands of people reached out to me saying they couldn't get their unemployment benefits. It was a time in news where what we did really, really mattered. There is, the government wasn't understanding that when you shut down businesses like that, first of all, it just overwhelmed the Department of Labor. So you can promise to get people unemployment, but if your system's not set up to help millions of people, that promise isn't going to be fulfilled.
And continuing our coverage tonight, CBS 6's Emma Quinn looks back at the challenges that COVID brought to our economy and the challenges we are still seeing today.
The start of COVID-19 brought many unknowns for everyone, especially business owners.
Every single day we were learning something new, or the state was coming out with a new directive, and businesses were struggling to adapt.
We all remember when the shelves were empty and no toilet paper in sight. Supply chain issues were some of the hardest challenges for all businesses.
I can't actually think of one that wasn't, right? Whether you're talking about manufacturers, folks that were in retail, and the fact that they were importing lumber.
Another challenge, determining what was considered essential. Real estate agents like Rebecca Cavalieri and her team at Gabler Realty were told to stay home. Once they could have remote showings, Cavalieri says interest rates soared as people were flocking from the cities to the suburbs.
No matter what kind of shack you were selling, it was selling for like 20% over the asking price. But it was still a very strong seller's market, and the inventory had significantly reduced.
For example, in 2015, there were 21,000 homes on the market. Jumped to 2019, it was 19,000. By 2022, it was 14,000. The last 2 years, it's been nearly cut in half of what it was a decade ago.
The problem is there's not enough housing. I mean, we're looking like we're going to have another amazing year, even though rates are still pretty high, because there's just nothing out there to buy.
5 years later, the region is still recovering, many still working from home or in a hybrid role, this leaving many commercial retail spaces vacant.
We're talking about how we can best repurpose some of these properties, potentially for housing.
For CBS 6 News, I'm Emma Quinn.
We listened to the scientists, the experts, and we put shots in arms. And together we conquered the pandemic and saved countless lives. Much of that work was done because of the incredible, dedicated, underappreciated by many, the staff here at Wadsworth.
Up next, the work continuing right here in our backyard, preparing us for the next big health crisis. Along with hospitals, laboratories, and scientists also played a huge role in the pandemic response. Much of the research happening here in the Capital Region was at the Public Health Lab, the Wadsworth Center in Albany. CBS 6's Lara Bryn takes us inside and speaks to the scientists who offer some insight into what went right and what went wrong.
Don't hear about laboratories. They work in the background. That's not a bad thing. But when there is a crisis, that's the front line.
The Wadsworth Center was the front line here in the Capital Region during the pandemic, analyzing thousands of viral sequences and depositing a huge percentage of New York-derived sequences in what became an international database. Dr. Leonard Peruski was at the CDC during the height of the pandemic. He now oversees the Wadsworth Center.
This was a disease we had not seen before, and it's scary.
Even scientists right here in the Capital Region say there were lots of lessons to be learned from the pandemic, but they think that those lessons have helped set them up so that we're much more prepared in case another pandemic were to happen again in the future.
Yes, I do feel we are in a much better circumstance right now for this state and for the country and even for the world for responding to another pandemic.
Both because of scientific advancements and from lessons learned in the past 5 years. Dr. Peruski says better surveillance systems are now in place. There's faster information sharing, and scientists have come to understand the things they did wrong, namely,
scientists are horrible communicators. We just are. And scientists, we kind of live in our little world, and we don't know how to explain things in practical terms.
He feels, for instance, they could have done a better, more compassionate job at sharing information about masks.
Who wants to hear, I have to go around and wear a mask? A lot of it comes down to explaining things, not talking down to people, but talking with people and listening to what their concerns are.
He also says the pandemic forced technological improvements.
Anytime there's a crisis, an emergency, you see changes. So that's been the other lesson here. We can innovate, we can try new approaches.
Should we ever need to in the future.
I want to thank them always for being on the front line during those dark, dark days and the sleepless nights and long, long months of research and making sure we had supply of our vaccinations, but also what they're doing now.
Important work right here in our backyard. Thank you so much to Lara and to the rest of our CBS 6 News team, and thank you for looking back with us at COVID-19.